Hi, this is Dalton Main. The title of my poster is Hand Grip Force Variations in Different Hand Grip Positions. A little background on my study. Electromyography has been used to test electrical activity of muscles by measuring motor unit action potentials, and in this instance, we're talking about the forearm specifically. The hand grip dynamometer was used to measure grip force and has been in previous studies. Grip forces have been shown to have the capability to predict injury, and specifically the wrist and forearm. The purpose of this study was to see how force was affected by various hand grip positions. I predicted that the standard wrist position would have the highest force compared to the other grips, and also that hand grip force would be higher in full wrist extension rather than flexion. The subjects we were worried about in this study, we had 8 subjects, 30%, 38% male and 62% female. We were looking at subjects between the ages of 21 and 40 who could perform wrist flexion and extension without pain. Our exclusion criteria included people with a latex or sensitivity to adhesive. So the methods for this study. We had the subject do a mock contraction to see where to put the electrodes. 2 electrodes were placed on the flexors, 2 on the extensors, and also 2 on a non-measured muscle, typically the triceps. We used a hand grip dynamometer to measure grip force, and for the purpose of this study, having the wrist in a neutral position was considered our standard value for comparison. Maximal force and EMG values were recorded for wrists maximally flexed and extended, as well as with a short hand grip and long hand grip. The statistical analysis for this study, we calculated the percent MVC, which is a force or peak EMG, divided by the standard force or peak EMG, times 100. We also looked at standard deviations and means for the force and percent MVC. Results. So for this study, standard wrist position did in fact produce the largest force as predicted, with the wrist extension being the next largest force produced. Long hand grip recruited the extensor muscles the most, while short hand grip recruited the flexor muscles the most. Discussion. So studies do support similar findings on neutral and wrist extended positions producing the greatest force. Forearm flexors are strongest in wrist extension because the extensors are shortened and the flexors are being activated to bring the wrist back to neutral. Neutral produce the strongest force because the flexors and extensors are in optimal positions to produce contractions. Finger flexion is accompanied by wrist flexion, increased with short grip, so it can continue to flex the fingers. It's decreased with long grip because the finger flexors are in an extreme lengthened position and cannot work optimally. Clinical relevance. So being able to notice these imbalances in flexor extensor muscles could possibly help prevent injury. It could also be used in a rehab setting when you're trying to recruit certain muscle fibers of the forearm for specific injuries. This is my poster, and thank you for listening.